Hello, everyone, and welcome to this flagship webinar conversation with MSI Nigeria. On this webinar series, we bring you various topics that concern you and your reproductive health and rights as Nigerians. My name is Rahama Bungulu, and I am your host for today. Good morning. So when this conversation came up, I thought it would be interesting to have a look at what menstruation means in different languages. However, when I was practicing, my colleagues had a great time laughing at me, and because I don't want to be known as the person that butchered menstruation in every Nigerian language, I am going to be sharing what menstruation means in my language, and then I'll pass it on to two of my colleagues who will also be sharing what menstruation means in their own native languages. So I am Hausa, and in Hausa, menstruation is known as Haila. Dr. Kola, as a native Yoruba speaker, please, what is menstruation in Yoruba? Precious. In Igbo, what do you call menstruation? So yes, three different languages, but we're all describing one thing, menstruation. Today, we are asking the question, what do women and girls want from men and boys to maintain their menstrual health? That's our topic for today. And to help us discuss this topic and understand it better, we have here today many participants who have joined this webinar that want to understand better. We also have hundreds of viewers on social media that are watching us right now and are also participating with various hashtags. And we also have our guest experts. But before I introduce our panelists for today's discussion, let's hear from the country director of MSI Nigeria, Emmanuel Aja. Okay, so we're having a bit of a technical glitch, but once we are able to get the country director on the call, he'll be taking his opening remarks. So please allow me to introduce our guests for today. We have Mr. Charles Ushie, country director of Plan Nigeria. We have here in this room today my colleague Aisha Adepe, project manager at MSI Nigeria. On the call, joining us virtually is Dr. Ishaq Lawal, obstetrician and gynecologist at the Federal Teaching Hospital, Birnin Kebbi. And then we also have Sarah Kuponi, founder of Alora Pads. And then finally, we also have Dr. Hamid Adediran, team lead, menstrual health and hygiene initiatives at PSI Nigeria. And finally, we have Mrs. Mariam F. Shuaibu, Deputy Director, Children's Development and Health Desk, Federal Ministry of Women Affairs. Now, moving on to the first segment of this webinar, before we begin our discussion today, let's just take a moment to reflect on the bigger picture. Every month, 1.8 billion females menstruate around the world, yet millions of them, especially young girls, face barriers that compromise their health, their education, and their dignity. In Nigeria, 1 in 10 girls have to miss school because of their periods due to lack of access to menstrual products, clean toilets, or supportive environments. And in many homes, menstruation is still a taboo. It's something that should not be discussed. So before we get into the conversation properly, let's just discuss the basic concepts of menstruation and menstrual hygiene. Dr. Ishaq, can you please give us a bit of a background on this important subject?
Hello, thank you very much for this opportunity to discuss the basis of menstruation with the team. Yeah, as when I was going through the topic, because it was going to guide us in discussing the basis. Now, we said that what does women and girls want from men and boys to maintain menstrual health? And when I was preparing for this presentation, I asked myself that if I know the answer to what women want, I think I'll be a millionaire, and that goes for any man. So having make that background is to say that menstruation for women can be very varied. It's as complex, as simple as it is, it also guided by complex systems, such that there's a very thin line between what is normal and abnormal. So what is known is that every month, a woman, a girl, when she attains the age of menarche, which is at average age of 9, starts menstruating. So the first menstrual period of a girl is called menarche. And from then, that menstruation becomes irregular. It comes not at a very regular interval until maybe 1 or 2 years when it becomes regular for most people. And when we talk about regular menstrual cycle, means that she menstruates every month, usually for a period of 2 to 5 days within a month, and usually with an interval of between 21 and 35 days. You can see this is not a 1 day or one period to define normal. Normality is a range, because that's one of the things that happens that people ask when they come to the clinic and say, oh, my menstrual cycle is not regular. And I ask them that if you take your breakfast every morning, do you say you take breakfast regularly? And they say yes. And then you take your breakfast every morning by 9 o'clock. The answer is no. Sometimes 8 o'clock, 7 o'clock, 6 o'clock, 10 o'clock. And provided it's taken in the morning, it's regular. So we don't define regularity of the cycle in a fixed period, is a range. So then in the reproductive age of the woman, from that 9 years when she starts menstruating, which we call menarche, she continues to menstruate regularly until a period that we call climacteric. And what that means is that a period where the menses begins to wind down. So if you notice at the beginning of the menses, at the beginning of the menstruation, it starts with being irregular, infrequent, and then it becomes regular. And when you approach climacteric, it begins to also become irregular until it then ceases. So, and the last menstruation of the woman is what we call menopause. When the menses ceases completely, is what we call menopause. So you can see it's a whole process in terms of reproductive life of a girl as she transitions from childhood into adulthood. So does the menstrual cycle changes. So, and as simple as it is that, oh, they menstruate every month, is guided by a complex system. The physiology and even psychology affects it. And one common thing that they talk about when we talk about what affects the menstrual cycle of a woman is that everything, because it's controlled at the hypothalamus level, hypothalamus pituitary level. Sorry, I'm using that language, but it means that there's a higher center in the brain that releases some hormones that controls the regulation of the menstrual cycle. And this center in the brain can be affected by even psychology, so that it's so delicate that even something as simple as price of commodity in the market can affect the menstrual cycle of a woman or of a girl, because the psychological effect is there. And that's why if you look at, take a survey of women in prison, for example, because of that challenge of being in the prison, by the time they are in the prison for 6 months to 1 year, their menstrual cycle ceases almost completely. And it's not because that they have attained menopause, but it's because of that negative feedback from the hypothalamus level and that psychological effect. And then stop menstruating because of that condition. So, in summary, is that the menstrual cycle of the menstrual cycle system is a simple preparation of the womb in preparation for reproductive function of the womb. Every month, the endometrial lining, that is inner lining of the womb, is shed if pregnancy does not happen. So, but if pregnancy happens, then that process is cut off and is suspended for the pregnancy to proceed and then to resume after pregnancy has after delivery. So this process can be affected by so many things, as I said. And one of the things that we also need to quickly talk about is what we call these things that this concept of premenstrual syndrome and menstrual pain. It's menstrual pain. It is a very challenging condition that is associated with menses that on its own is not it's not a problem, it's not a disease, but it's just that for that particular girl or woman, her physiology is such that the menses comes with pain, and it can really be difficult and very distressing to manage, so that because a lot of times the management might need to be to suspend the menses because it's the physiology of the menses that is bringing it about, and if you suspend the menses, there won't be ability to get pregnant, and because most women want to get pregnant, so what we do most of the time is to manage conservatively. So in summary, I hope I've just tried to get you through the process as changes that happens in terms of the life course of a girl as she transitions from childhood into adulthood and into the menopausal state regarding the menstrual cycle.
Thank you
So,
so much, Dr. Noel, for that. That was very informative. I think one of my key takeaways, or one of the interesting things that I picked up on is when you mentioned that there's actually a part of the brain that controls the hormones that is very delicate and that can be easily affected and that eventually can result in the menstrual cycle being influenced and affected. So thank you very much, Dr. Noel, for that. I'm looking forward to more insight that you're going to share later in this call. So we now have our country director of MSI Nigeria, Emmanuel Aja, who will be giving us the opening remarks.
Good morning, colleagues, and apologies for the technical glitch that I had. I could not take this. I want to welcome in our colleagues who will be supporting us in managing the conversations that will go on in the next 1 hour, 30 minutes. It's so exciting to see other colleagues willing to join us have these conversations. So in no particular order, I want to recognize all of you, starting from Miriam to Charles, who is my very good friend and colleague, Ishaka and Sarah, as well as our own Hamid. On behalf of MSI Nigeria, I want to welcome all of us to this webinar. This is second in the series for us in this 2025. And for us, it's yet another timely conversations that you're coming in for us to have and look at the health of our girls, our mothers, as well as our women. The topic of today, which is what do women and girls want from men and boys to maintain menstrual health is another reminder of the importance of menstrual health to the entire reproductive health of women and girls. Hence, the need for us to prioritize this. For us in MSI, menstrual health goes to the root of gender equality, social inclusion, and the general well-being of girls and women. So for us, every adolescent girl deserves to manage her period with dignity, safety, as well as all the support that can be gathered as far as the community is concerned. But we know that unfortunately, because of lack of awareness, for the level of stigma that we receive and lack of support from males in the lives of these girls and women, leave them with lots of difficulties. So this is where the conversation for us is very critical, because men, fathers, brothers, teachers, policymakers are critical and central to reshaping the narrative surrounding the menstruation and menstrual health. So I urge us to listen. We have the best of professionals who are here with us. And for those who are not equally panelists, we equally know that we have professionals who will be making contributions. So it's not just about the panelists. There will be time for questions, and then there will equally be time for you to continue to drop your charts. It's for us to learn, share, and contribute. At the end, we want to make sure that we are supporting our women and girls to ensure that we have period-friendly society. So I once again welcome all of us to this lovely conversation and urge us to equally be on the lookout, because in a few weeks of another month, we equally be having another topic of discussion, which we think will continuously be relevant to the course of the work that we do. Thank you once again. I will hand you over to Rahama, who will take us through this and continue to moderate, working with the rest of the panelists. Once again, on behalf of MSI, you are all most welcome to this conversation.
Thank you, Emmanuel Aja, Country Director of MSI Nigeria, for the warm and strong opening remarks. So I've introduced our panelists, and we've gotten a bit of background on menstrual health and menstrual hygiene already. So I'd like to dive straight into the questions for today, and I'll call on Charles for the first question. Mr. Charles, how much priority do you think society and communities attach to menstrual health, especially for girls and adolescents?
Thank you very much for inviting me and for creating this space to have this conversation. So your question is, how much priority is society giving? Is that correct? Yes. So in my experience, I haven't been in this sector for quite a while, over 2 decades, and haven't been in this particular stream of work. I think the priority is quite low, very low, and it's a shame and it's unacceptable. And I'll give you my reasons why I say this. For many people who know me, you will know I've been an advocate of menstrual health, particularly the sanitary pads for girls. I've been an advocate for years, for decades. And many years ago, this was over 15 years ago, there was a major conference here in Abuja, and I was privileged to be one of the key speakers. It was an international conference on health, universal health coverage. This was over 15 years ago. I was the country director for another organization at that time. And this was a big conference. All the donors were there. And one of the things I advocated that day, which of course I came under a lot of, attack, I advocated that we are not giving enough priority to something that is biological and something that is constant. We just had a doctor here who gave the biological and physiological experience of what menstruation, and you clearly could understand from that conversation that menstruation is biological, it's not a choice. However, as at that time I made this conversation at this conference, Nigeria was spending our tax money to import over 70 million condoms every year. And I found that to be unacceptable. And the reason I said that was, what was the basis for investing our common good and money into something that is a thing of choice? If a man wants to use a condom for sexual activity or whatever it is, it's choice. He can afford it. He can choose to do it whenever he wants to. But a woman will not wake up and decide when to menstruate or not. So you see, priority now begins to show where we put our resources and where we put our money. If you go to some of the major government offices today, this is over 15 years ago now, you will find out that in many government offices, many big offices, there are things that are bought for with government priority. Almost all government offices till today still order newspapers with government money. They provide newspapers at the office every day, every blessed day, and they provide all the variants of the newspapers. They spend money on that. Many companies and offices till today still provide free condoms for their staff. When are we going to get to the point where the government realizes, companies, individuals realize that menstruation is not a thing of choice? So the way we put priority on some of these things that are actually things that you can do without, we should begin to also put priority on the things that women cannot do without. So it brings me back to the question, who makes decisions over our budget? So many of us have advocated that one of the single most important instruments for any country to thrive anywhere in the world is their budget. Question is, who controls our budget? And my argument here would be that let's reimagine that we have more women who sit at decision making when it comes to our budget. What kind of decisions do you think women will make? If a woman who knows that menstruation is compulsory and everybody must menstruate, in fact, maybe the woman sitting there making that decision actually has her menstrual pads in her bag, what kind of decisions do you think she will make? Maybe the conversation would have come up by now that menstrual pads should be free, should be affordable, should be available everywhere. And until we get to that point, then it will not become a priority, because our priority is revealed by the kind of policies, by the way we distribute our resources, by the kind of policy, political decisions we make when we come to sharing national, what we call national resources. All of this reveal, without saying anything, the priority we put. So in my opinion, the priority is still very low because primarily the people who make decisions are actually not women, are people who are not affected directly. It is men. And that is why men should be the ones having this conversation on behalf of women. Because whether we like it or not, the reality today is that men still make decisions over our budgets, over our collective livelihoods. And men should recognize that this is compulsory. So I'll stop
Thank
there.
you so much for that strong point, Charles. So you've given us a bit of highlight. You've highlighted, how low of a priority it is when it comes to governance, and also even in the development sector as well, based on your experience with that talk that you had given 15 years ago. So I'd like to go over to Dr. Hamid. You work in communities. Do you think that people have a good understanding of menstruation and menstrual health at community level?
Thank you very much, and good morning, everyone. Special regards to the country director of MSI Reproductive Choices Nigeria, Mr. Emmanuel Aja, boss. Well, the question actually, if you permit me, would be because we go into the on a general note.
Sorry, Dr. Hamid, I think we lost you for a few seconds. Do you mind please repeating?
Okay. Am I audible now?
Yes. We can hear you. Go ahead.
Right. Communities. The question is, how well do people generally menstrual health communities? How much do they know? And our experience conducting trainings across our 6 implementing states is quite wide. Before we start the pre-training assessment, we conduct pre-tests. In the kind of results we get, the revelation that even those who have been so many years of the concept of menstruation and menstrual health. So no, we do not have enough knowledge even before we get to the communities. And yes, do not have enough knowledge about menstrual health. And it is a gap that we to support, and it's a gap that we really need to do. I'll give you an instance. The kind of cultural taboos and practices, even among stakeholders, among decision makers, among teachers, principals that we had to engage. It's just some, and more needs to be done.
So thank you for mentioning that. I mean, I think Aisha, you also manage a project at MSI Nigeria that aims to integrate menstrual health with other aspects of reproductive health, and this is implemented even at community level. But I really want to understand, why is this work so important?
So thank you very much. So MSI is implementing the reproductive health and pandemic resilient project across 5 states: Adamawa, Katsina, Kebbi, Taraba, and Zamfara. We said this implementation commenced in 2023, and we are still implementing. So the objective of this implementation is to ensure women and girls have access to integrated sexual and reproductive health services and pandemic resilient information and services. So the sexual and reproductive health services we are currently providing includes menstrual health, cervical cancer screening, as well as sexual and gender-based violence management. So why is menstruation very important? So you see that a woman's reproductive health kicks off at the onset of menstruation up to menopause. And it's important that a woman understands what her menstruation cycle is, what affects it, and the challenges she has in between, so that she's able to manage her menstruation. And for us at MSI, we offer family planning services across our 3 channels, including public sector strengthening channel, our outreach channel, as well as our MS Ladies channel. And one of the first questions that you're asked once you go to the facility is, when was your last menstrual? When did you last see your last menstrual cycle? So to be able to even uptake family planning services, it is very important that you are aware of your menstrual health cycle. And we found out that some girls and women don't even know, when their cycle was, their last cycle. And that is what prompted these services to be provided. Counseling women on understanding their cycle, making sure that they are able to track and reflect back when they are about taking services. So it's very important that we provide these services so that we are giving quality FP services at all our channels.
Thank you, Aisha. It's interesting. One thing that I picked up from what you just shared is, for something as basic as tracking a menstrual cycle can seem to, a lot of us that have a lot of knowledge, have more knowledge and information about menstrual health. At community level, it's clear that even something as basic as that, is not a common practice. So I'd like to move over to Sarah. What are you learning from the girls, that you work with about this topic? Is Sarah on? Sarah, if perhaps you're muted, we can't hear you, but we can see you're on the call.
Morning, everyone.
Sarah.
Okay. So for me, working in the community so far, the experiences of girls that we've learned from them that they've shared with us is the fact that, you know, issues of menstrual health. I know the doctor has talked about the um biological part of it and the physiological part of it. There are still more other challenges it has or impact it has on the girls. For them having lack of access to products, it impacts their academics. They are not able to go to school or stay in school. So it has impact on school attendance. It also have impact on their overall health and well-being. It has impact on economic development because if they're not able to go to school and they are not educated, how would they be able to, finish schools and get a job and what have you? So what we've seen so far in the community is that there is this overlapping impacts of not having access to products has on the girls. Also, there is also the issue of lack of awareness on menstrual health education or information before they start. So when they start, they have this shocking revelation of what their body is going through. So there's been the instances where young girls, we approach them when we go to the schools, and then they tell us they don't even know what happened to them. They just suddenly saw blood. Nobody, pre-informed them about what was going to happen to them. At times they get stained in the course of this because they were not aware. So this has lots of impact on them. So for us, engaging with girls at the community level, what we've learned so far is that there is need, like Dr. Amia said, there is need for provision of menstrual health products so that it helps them stay in school. There is need for access to information about how to manage their menstrual health, how to manage their period in a dignified manner. Also, there is also need for the government to look into the wash facilities in public schools, most especially because this also impacts on the way the girls observe their hygiene, and also to get the involvement of boys so that there will be reduction in stigma whereby the boys laugh at the girls because they see their clothes stains, especially for a girl that is just having a period for the first time and she's not aware of what was happening, rather than the boys laughing at her, which leads to stigma and shame. So those are the things we've been able to see across at the community level and that we've been working on ensuring that these are addressed.
Mm. That's amazing work that you do, Sarah, and we hope that we can all contribute to doing it. So I'd just like to take a few moments, to have a look at to give our participants a chance to also be involved. We have a question from one of our participants on Zoom. From Abdullahi Isa, this question is directed at Charles. So thank you for speaking passionately about the knowledge gap and the lack of political will. In your experience, what are some practical ways that we can start closing these gaps, both at community and policy level?
You want me to respond?
Yes, please.
Oh, okay. I mean, practical ways which can manage this. An example is, for instance, in Bauchi State. In Bauchi State, through one of our projects, we're able to set up what we call pad banks in 10 local governments, in 10 schools. And what this pad bank did was to provide free sanitary pads in the school. We used it to collect data, of course, of the girls to see the frequency and all of that. Of course, like our colleague said, girls miss as much as 54 classes in every calendar year because of their menstrual cycle. 54. That's a lot. The question is, how many do boys lose? Boys do not lose anything because they don't go through menstruation. So you see that it's both a political and a health issue, right? So we made this pad bank available in schools and make girls come to school. Now, what has happened is that the government has looked at this model. We did it in conjunction with the Bauchi state government. And right now, as I speak to you, they've passed a legislation where they have included sanitary pads in the state budget, budget across all the local governments in the state. It is now left for the citizens to follow up to say, where are the parts that have been budgeted for? But it has been put in the budget. It's laudable, it's commendable. They have a policy, they have a state policy now that there will be legislation, there will be appropriation for menstrual hygiene, kits for girls in Bauchi State. It's the least we can do. What did it take to get that? We just showed an example and escalated it to the state level. Adamawa State is doing doing the same. They are passing a legislation as well that will provide free menstrual pads and provide other, services. So for me, that's an example. Whatever it is we do at community level, let's find ways to scale it up. In churches, in mosques, what does it take for the church and the mosques to provide free menstrual pads for their girls in their churches and in their mosques? In markets, in schools, in offices, in my office in Plan, every office of Plan International in Nigeria, we have free menstrual pads in the toilets, just the way we provide condoms. These are very simple decisions to make. It doesn't cut anybody's neck. So for me, those are simple examples that we can use.
I think you've clearly shown that by putting these, things into practice, that we can actually achieve a lot, even at government level, whether it's on a personal level. And it shows that, there are practical ways that we can bring solutions to a lot of these challenges that we're discussing. So if you're just joining us, this is the MSI Nigeria webinar, and we're discussing the topic, what do women and girls want from men and boys to maintain their menstrual health? We've heard from all our panelists so far. We have Charles Ushei, Country Director of Plan, Aisha Adekbir, Project Manager at MSI Nigeria, Dr. Ishaq Lawal, Obstetrician and Gynecologist at the Federal Teaching Hospital, Birnin Kebbi, Sarah Kuponi, Founder at Laura Pads, and Dr. Hamid Adebiron, Team Lead, Menstrual Health and Hygiene Initiatives at PSI Nigeria. The conversation has been very enlightening and interesting, and we're just about to go into our second segment. So thank you to all our speakers for layering such a strong foundation for this conversation. But let's move on to another important part of this discussion, and that's the real challenges that women and girls face around menstrual health in Nigeria. From harmful social norms to poor water and sanitation facilities and the added challenges faced by those with disabilities. These barriers are real and they're widespread. In this segment, we're going to hear from our speakers what these challenges look like on the ground and what strategies are being used to close the gaps and to prevent deeper consequences. So let me start with Sarah. You've highlighted some of the common challenges that the girls you work with face concerning menstruation. But can you also give us more insight on some of the strategies that you're using to close these gaps and to prevent deeper consequences?
Thank you. Thank you very much for that question. So some of the gaps that we've identified and now we've been able to close them is that at the community level, we provide menstrual health education through a non-profit harm, a well-informed adolescent initiative. So we use that, we do that in various ways at the community level, working with the community leaders to have like a safe space at the community town or on a weekly basis. And then we also do school-based campaign where we go to schools to provide menstrual health education. And then we also work with governments and other non-for-profit entities to provide reusable pads. So where we provide reusable pads to schools, using the leverage of having like an event, menstrual health event that we create awareness on menstrual health and education and then distribute the product to them. Another instances is where we do the train the trainers. So we have like some non-for-profits like UNFPA. We work with UNFPA where they set up a center, like a safe space center, and also simultaneously have it like a skill acquisition center where girls can also come into that space, have access to tools and resources they need to make homemade reusable pads for themselves. So we train the girls. We have like some girls at the communities that are trained so that they stay or volunteer in that safe space for the young girls that come around, and then they train them as well on how to make their own reusable pads or how to identify fabrics around them that they could use that would definitely make a comfortable product for them. So those are the ways we've been addressing this. Hello. So those are the ways we've been addressing these challenges through creating menstrual health education and awareness, through product distribution, as well as through training of girls on how to make their own homemade pads. And then we also leverage digital tools like social media platform, and also we're currently working on a WhatsApp enabled chats that young girls in urban area can use, to ask questions that they are finding difficult, because that's another thing we noticed, this culture of silence and shyness around menstrual health, where young girls cannot really ask questions about their period, they're shy, and then maybe the guides, their parents do not have time for them. So those are the ways we've been addressing these challenges.
Okay, thank you, Sarah, for sharing that. And while you were speaking, actually, there's a comment in this webinar from Nasser Ismail, who is a boarding school teacher in Gombe State. And he shared that there are a lot of girls, there's a lot that needs to be done to enlighten our young girls, that there's no provision of pads from the government, which is discouraging some of the girls to even attend the boarding school. So this actually highlights a lot of the challenges that you've mentioned, but also it shows why these solutions that you mentioned are so important. So I believe Mrs. Mariam has joined us. Mrs. Mariam has joined us. I'd just like to take a moment to welcome her and appreciate her for joining the webinar. And also just to hear from her as a government official. As a government official, we just want to understand how important is menstrual health for girls and women to the government, and what is the ministry doing in order to approach this? Mrs. Mariam? She with us? Mrs. Mariam, if you're speaking, perhaps you're muted. Okay, so once we're able to resolve that with Mrs. Mariam, she'll give us some insight. But so let me just move on to the next question. Aisha, the whole topic of this webinar is really how men and boys, can be involved and to make things better for menstrual health and hygiene. So how is male involvement in the states that you're implementing in helping to normalize menstruation?
Okay, before I go into that question, I'll just give a short story of a girl that went to visit one of her friends, who is a boy. And she was feeling some kind of way, went into the toilet and found out that she had her period, but she didn't know what that was. So she came out, was a bit uncomfortable. Her friend saw her stain, and he started shouting that, oh, his friend is dying, she's bleeding, he's dying, he was just raising alarm. And his father walked in, and he now told his father that, oh, my friend is dying, she's bleeding. And the father did not know what to do.
Wow.
So he was also confused, and at that state, they had to just call her mom to come and get her because they really did not know what to do, and the next call they put through to the girl was to ask, oh, are you still alive or are you dead? Because we saw you bleeding, because they had no idea what was happening to her. And that's why it's important that men get involved, because this kind of situation can happen in our houses, in our homes, and just everywhere around us. So on the Care W project in MSI, we recognize that menstruation is a big deal for women. As I said before, it's the onset of a woman's reproductive health. So if you have a wife, you have a sister, you should understand that once the woman starts to see her menstrual period, her reproductive health has kicked off. You should be able to know the basics on how to support her in case there is no mommy to support at that time, what she needs and how just to make her comfortable. And as a man as well, that can also even help you plan your family, if you understand your wife's menstruation cycle. So what we're doing on the KFW project is normalize conversation around menstruation in different men groups. So we work in different groups, men groups, we work with religious leaders, we work with community leaders, we work among men that, just different groups of men, religious leaders, community leaders, network of men, and men in the workplace, different men groups. Our demand creation team go around to have conversations on family planning and sexual and other sexual and reproductive health services, including menstrual health. And we're seeing that conversations are being normalized, among groups. We tell them about menstruation and the products that they can use. Like for us in MSI and on the KFW grants, we're also even giving out reusable pads. So we talk about reusable pads and other products that can help, a girl to manage her period and other support that she might need. So we are seeing conversations around menstruation being normalized in community spaces, in schools, and men supporting their wives as well.
So I'm so glad you mentioned the different groups, because an important category also that should not be neglected is people living with disabilities. And menstruation will definitely affect them in a different way than it does of members of the rest of the population. So I actually want to understand more from Dr. Hamid. You're implementing in 6 states you mentioned. What do you think is the most challenging aspect of menstruation for women and girls living with disability?
All right. Thank you very much. Well, excuse me. I'll take that comment, that question, but I actually wanted to add to one of the questions that was asked initially, and I mean, I wish I had an opportunity there, and I hope it's not too late, about what we should be doing in the community and in terms of policy to change the narrative. And it's interesting that as of today, Nigeria does not have a policy on menstrual health. For me, if that does happen, then the question is how exactly we to drive the narrative as they should be, because we all know that it's conversation, it's a policy that would help us even in our advocacy. It's what we need as a tool. We run in the communities as we have a list of people we call the menstrual health assembly champions in the communities, and people with disabilities have their specific challenges, and that's why in our convening at the various technical working groups that we supported establishments at the subnational level, we ensure that they are adequately represented. And yes, because of the peculiarity of their situation. For instance, when we look at communication, how do we communicate comprehensive menstrual health education to people with disability? The first is that we identify that disability and try to meet it. So what we do is that we engage with groups who are working with people with disabilities, such that whatever message we have, they take it and then they can interpret it in whatever ways to those with disabilities, because they are an integral part of every of our conversations, our trainings, and so on and so forth. So when they don't have the right education, or we get to a place and we think that we're communicating, but we're not communicating because the person is not even seeing your description. So when we have a group, this group of people in our midst, in our conversation, developing the materials together in our trainings, they're able to translate and interpret it to this community, so they're carried along in every step of the way of education. Now, in terms of access, we've talked about providing the right infrastructure for a menstruating woman, for instance, or for menstruators generally. Our facilities for people with disabilities. And those are the gaps that we are trying to bridge. Those are the gaps that we seek, that we work with other partners to ensure that we bridge and address all those challenges that we have identified. And of course, we're in constant touch with our MA champions in the community. And as soon as these gaps have been identified and brought to us, we use it to tweak the project and see how well we can address these issues. Suffice to say that the implementation of our program actually started with a co-creation workshop where, interestingly, this particular group of people were identified, and that's what influenced what we're doing. I've also heard you mention other communities such as people in correctional facilities. And all of these are being factored into the national policy on menstrual health that the MH Now project for PSI is supporting the Federal Ministry of Women Affairs and other partners to develop and finalize in Nigeria.
Thank you, Dr. Hamid, for giving us that insight. There's been a lot of conversations about, well, really the reason why we're here is when it comes to male engagement in menstrual health and menstrual hygiene. And I really want to come back to Dr. Lawal, especially because earlier when you were giving us the background and the context about menstrual health and menstrual hygiene, you had mentioned menstrual pain and you had also mentioned PMS. And so we want to understand, obviously many women suffer silently through severe menstrual pain or irregularities, as you have given us that background. But what role can male partners or caregivers play in encouraging the women to seek timely medical help? And what are practical steps that they can also give to the women, before they're able to seek that medical help? Dr. Lawal.
Yeah, thank you very much. Sorry, can you hear me?
Yes, we can hear you loud and clear.
Yeah, apology. I think I just had some glitch in my technology. I'm switching device. So yes, on to that question, I just want to also re-thank you. I thanked the organizer earlier because as a medical doctor, I have been, and not ordinary medical doctor, a gynecologist for that matter, I have properly been educated again because my understanding of menstrual cycle and menstrual activities has to do with the physiology of it, and listening to the country director.
Dr. Lawal, are you there? I think we've lost you.
Hello?
Yes, you're back now.
Yeah, sorry, I might need to switch off my camera and then so that we...
No problem.
Yeah. So I said that listening to this social angle to the menstrual health is really enlightening for me even as a gynecologist to the knowledge of the menstrual cycle. Because for us in the medical field, what we look at the menstrual cycle in pure physiological point of view, where it is a system of the body that is in preparation for pregnancy. But so I appreciate the knowledge again. But specifically talking about what men and boys can do to support the women in terms of the physiology of what is happening to them. First thing is that they must be educated on the implications, the process of the menstrual cycle, and the fact that it varies from one person to the other. So that, for example, a man with his fiancée, having maybe before he met her, his sisters had a particular pattern. There's no pain with her own cycle, or she menstruates for just 2 days, and now is having a fiancé that is maybe having menstrual pain or having menstruating for like 7 days. And then because he has been brought up with the fact that not the knowledge, but the fact that his experience of the women around him is different from the experience with his fiancée, it might begin to create some conflict. So from my own angle, the first thing is to properly educate the boys and men on the physiology nature of it and the diversity in its presentation. Of course, having done that, the next thing is that they need to have empathic approach to relating with their females, either sisters, girlfriends, mothers, or wives, in terms of helping them to cope with the challenges associated with the menstrual cycle, and of course, then the hygiene, because the blood is a very good culture medium, so that if it's not properly taken care of, then
Yes.
there is a chance of infection. And with the infection, either the reproductive infection or urinary tract infection, there's a risk in the future of affecting fertility. So the men as well needs to understand all these challenges that can happen to a simple process,
Yes.
and then so that they can support the girls. Thank you.
Thank you, Dr. Lowell, for giving us those practical but very important steps that men can do to support women and girls during their menstrual periods. Mrs. Mariam, are you on the call? Can we move to you? So before, we're still trying to get Mrs. Mariam on the call. She really wanted to be part of this so that she could give her perspective from as someone that works for the Federal Ministry of Women Affairs. But while we work on doing that, I just as we're coming to the end of this webinar today, and this topic is very important and it's been very enlightening hearing all the different perspectives on menstruation and the male responsibilities that men have towards women. But I just have one question for each of our speakers, and I'd like to ask that you limit your responses to a minute maximum, please, in the interest of time. Let me start with Dr. Hamid. As a closing question, as a closing question, so just give me in 1 minute, what can men do? What can men do? What do women and girls want from men and boys to maintain menstrual health?
Okay, so to make it simple, I'll look at it from the three lenses the lenses through which we approach menstrual health on our program. One is demand in terms of comprehensive education. Second is on access, that's like supply in terms of affordable and accessible menstrual products. And the third one is providing an enabling environment for menstrual health, for menstruating men, girls and women. If every man can take it upon themselves to take responsibility for this tripod, on how to hold this tripod, and they have done a great service, great help to enhancing the menstrual health of girls and women across, wherever they are, across their circle of influence at home, in school, and even as policymakers. So those three lenses would guide whatever support that boys and men can provide for girls and women when it has to do with menstruation. Thank you.
Thank you so much, Dr. Hamid, for your contributions. Aisha, I have the same question for you. What do women and girls want from men and boys to maintain their menstrual health?
Okay, so I'll speak as a woman, and I want my husband, for instance, or my brother, not to put me in the same bracket as other women. My menstrual health is different. Every woman's menstrual cycle is different. Understand what I need or what I'm going through and provide that support. I might not want to be disturbed around that time because Dr. Ishak talked a lot about how our menstrual period changes and what we notice. So things can change. So please understand my cycle and support me. If I'm not feeling okay, if I have the mental breakdown during my period, please support me during that time. If I'm not able to stand up or do my normal house chores, please support me during that time. I think this is what is on every woman's mind and what they will want and how they want to be supported.
Yes, I know I'm personally seconding that contribution. Okay, Charles, I have the same question for you. What do women and girls want from men and boys to maintain menstrual health?
I think it's straightforward. Decision making. We should make decisions that favor women, knowing that we're not doing them a favor when we do that. Instead, we're actually doing the right things. So for men, if you're in a position of authority, please use your authority to make decisions that favor women's menstrual health. It's as simple as that. Thank you.
Sarah, before we let you go, please, what is your response? What do women and girls want from men and boys to maintain menstrual health? Okay, I think we don't have, Sarah had to drop off for another conflicting activity, but I just want to quickly take the chats. Amarachi, Aisha Amarachi is thanking you for supporting, for that valid comment, and she's asking the boys to support us. We also have okay, so we have a question from Samina. Good morning, everyone. I am glad to be in this gathering. Thanks to Mr. Charles for his information. My question is, oh, sorry, let me take a question for Dr. Hamid, actually. So from Abdullah Isa, I'm interested, Dr. Hamid, this question is for you. I'm interested in how you measure the impact of your sensitization efforts, especially given that stigma around menstruation still exists. Could you kindly share with us what indicators or approaches you use to track progress and change?
All right, thank you very much. Without necessarily going into the details of our M&E framework, I'd say, building on what I just mentioned now, first is that we are interested in how many women are reached with education. As I said, we've been able to train and recruit menstrual health champions across all the states, and they have a mandate to disseminate the message to women. So we want to know how many women did you provide that information to. They're also expected to conduct community dialogue sessions. In doing so, we are interested in how many community dialogue sessions you've conducted and what the content is. That's need I say that the menstrual health champions are in three forms. We have them as teachers in school, we have them in the communities as community influencers, and we have the healthcare workers in the various contiguous healthcare facilities. So with this, we're tracking how much of information and education has been passed across. In terms of supply as well, we're tracking the number of products that have been distributed. We've identified producers, local producers who are women in each of these states, and we're interested in how many they've been able to sell. We're also interested in how many women they've been able to reach with this product. So at the end of the day, we're seeing the ripple effects or whatever efforts that we're making in this regard. And we believe that together, all of these would feed into an improved menstrual health education and services for women and girls in implementing states. And of course, we can feel the ripple effects from at the national level across other sectors that we support.
I just want to quickly, we have questions also from our social media participants, and I want to quickly ask Dr. Isha, just very briefly, can you give us an insight on what the causes for irregular periods are?
Yeah, thank you very much. The first thing is to first determine what do they mean by irregular period. What I have noticed is that most of the time, what they call irregular period are not irregular. So they will tell you that, oh, they want it to be regular in the sense that if they menstruated on the 2nd of every month, that it should be on the 2nd of every month. No, that is not the irregularity. What we do to determine irregularity will be that it should be outside the normal 3 to 7 days and a cycle length of 21 to 35 days. Usually, what we say to define irregularity is that there must be a difference of 10 days between your previous cycle length and the current one for you to say it's irregular. So having first clarified the fact that most of the things that people term irregular is not a medical definition of irregular, then there are some basic things like when the woman first starts their menses, it comes as irregular. And when you're going to end the menses, that's that towards the end of your reproductive career, it also comes as irregular. Then there are some disease conditions, common disease conditions, things like polycystic ovarian disease, that then can be a cause of irregularity. But the good thing is that, except you are looking for pregnancy, irregular menses or lack of menses does not cause any health concern, because some of them think that if it's not regular or if they are not menstruating, maybe the blood that did not come out will now cause a disease for them. No, it does not cause any health concern. The only thing that is of consequence is ability to get pregnant if you are looking for menses. I mean, if your menses is regular. Thank you.
Okay, so one last question from Nasir Ismail. Hello, Charles, MSI team, and PFI. I'm Tony Enere from Youth Empowerment Foundation, Lagos, Nigeria. What efforts are development partners doing to ensure that free menstrual pads are available across public schools in Nigeria? Charles, would you like to take this question?
Yes. So I think I've mentioned this a bit. Menstruation is not something you start and stop today when you like and feel like. So it's important that investment in menstrual health are actually appropriated for by our budgets. If it is budgeted for as an appropriation act, then it becomes a lifelong thing, just the way we budget for roads, the way we budget for water, the way we budget for books. That's it. Then, for organizations like us, we should make deliberate effort that as we budget for consumables in the office, menstrual pads are part of consumables. That's the kind of policy we have in Plan International. Menstrual pads are consumables. We treat it the way we buy milk and sugar. That's the way we buy menstrual pads. So it's part of our everyday lives. So in this way, people don't see it as a taboo. Both men and women see it as part of their everyday life. And then the acceptance is there and then becomes a collective effort rather than trying to do it as a one-off stunt where people buy parts and share on their birthdays and share on events. That's not it. We can't get far with those kind of practices. Thank you.
Thank you, Charles. So we now have a question from Abdullahi Isa. Aisha, I think I'll direct this at you. Do you think it's time we start creating more awareness amongst religious leaders on the need to normalize and formalize conversations about menstrual health, especially for both in-school and out-of-school adolescents?
Yeah, so because in the community we get messages from mostly our religious leaders and community leaders. So if religious leaders are able to normalize these conversations in their sects, it will go a long way to help to break down all the barriers that are preventing male involvement in talking about menstruation. There's a lot of work to be done. We've started, but there's still a lot that we need to do. If we can, in our small spaces, begin to see how we involve men in talking about menstruation, supporting menstruation efforts, a lot of things will change. We can start from our religious bodies, community bodies, schools as well. Let the male teachers talk about menstruation freely, during the assemblies in classes. This will go a long way in ensuring that we have more support from the male folk when addressing menstruation.
Thank you, Aisha. We have two participants that have their hands raised. So Karam, can you please unmute? Let's hear what you have to say. Karam, are you there? Okay, I'll just move over to Opeyemi. Do you want to unmute? Let's hear what you have to say. I didn't put on. Opeyemi, are you there? You can unmute and go ahead. Okay, well, I'll just take one last question from social media. The question is from Anne. Some women and girls experience severe pains that keep them away from work, school, or daily activities. How can men or boys, support the women and girls during such pains? Dr. Hamid, can you take that question?
Well, essentially, we have a campaign where we tell people that menstruation is normal. So if every man sees menstruation as normal, in the sense that even if you have pain, it doesn't take away the fact that it's a normal process. For instance, that I have a headache does not mean that my head is no longer is now abnormal, or I'm no longer a normal human being. It's just a headache. And what do I do when I have a headache? I get treated. I take whatever help I can get. I appreciate that. That's the same way we want boys and men to support the women whenever they have such pains. That's how we want, even at work, that's how we want bosses to support the women colleagues, women staff to, whenever they're going through any complication or any challenge during their menstruation. That's our expectation. And if we see menstruation as normal and anything untoward around it is something that just requires help at that particular time, then we will all be conscious about it, and we will not start seeing that woman as any less because of the attending challenges or complications as a result of menstruation, which is actually a normal process.
Thank you, Dr. Hamid. So I'll just hand over to Karam. Very briefly, please, what is your contribution?
All right, thank you so much. I must say this has been an insightful conversation thus far. I had actually just tried typing since I wasn't able to unmute myself to speak, but I'm happy I'm able to do that now. So my name is Karam Mokoye, and as an advocate also of a menstrual health policy in Nigeria, I believe that male engagements must also be included within the workspace, you know. And one better way I think men can intentionally be involved, as someone was actually, one of the speakers spoke earlier on how we prioritize the the budget for condoms over menstrual pads. And that is to say, if men are up there at the helm of affairs, it could be better. And one major thing I would say could be at the center of this advocacy is menstrual health holiday leave policy. I believe that this is doable because even in Nigeria, we have success stories as the Action Microfinance Bank. We have Spain in 2023, where they were able to pass this policy that within 3 to 5 days of the month, women can actually go on a leave or holiday who have, menstrual challenges. And the call for me here is I feel MSR as an organization can also begin to implement this policy, and other social entrepreneurs here, I would say, if that policy is not yet implemented within our workspace. And I would want us to see this as perhaps a retainership strategy also as a plus in implementing this policy. And then finally, my question would be, what is MSR doing, or what would MSR help to do in amplifying this advocacy in terms of menstrual health policy? Because I think one of the speakers clearly said earlier, that we don't have menstrual health policies in Nigeria in place. So as social enterprise, what can we do? Is MSR open for collaborations? Because I believe there are several young minds like myself and several organizations as MSR that would really, really want to see this policy come to place. And in order for our voices to be amplified, in order for our work to be heard, for our success stories to be heard, someday, is when we come together in collaboration to see this happen. So I don't know if I'm clear. Thank you so much.
Thank you, Karen. You're very clear, and your points are duly noted. Actually, you asked what is MSI currently doing, and one of these things that we're doing is this webinar right here. As we mentioned, this is a webinar series that takes place on a quarterly basis, and the decision was made to ensure that in honor of Menstrual Hygiene Day, that this webinar would focus on menstrual health and menstrual hygiene. As Aisha has also explained, a lot of the work that we're doing at community level is to improve menstrual hygiene at community level, but also at government level, because we also do a lot of advocacy. And in response to your question, yes, we are always open for collaboration with other organizations, which is why we have Dr. Hamid and Sir Charles on this call, also collaborating with us to raise more awareness about menstrual health and menstrual hygiene. So last but not least, Opemi, you've been very patient. We're really out of time, but we appreciate you for participating and for wanting to speak. So I'll just give you the floor very quickly, and then we will close. Opemi, you can unmute and share your contribution.
Yeah, thank you. Thank you so much to all our panelists for all the insightful information. I have learned so much more this morning. My name is Okoyemi Agumbiade. I'm the Sexual and Reproductive Health Coordinator of Ondo State Primary Health Care Development Agency. Now, I just have two questions. Firstly, over time, we, especially on this day, celebration of menstrual hygiene, most people goes around to schools to reach, meet young girls and, distribute menstrual pads to them. And today, we've even done a session today and so many are ongoing. Now, my question is that what happens after this pad is exhausted? Can we be thinking about how to sustain, the use of reusable pad for girls? Because these products are getting expensive day in, day out. Now, how do we introduce this reusable pad across board so that at least those that cannot afford purchasing this product will be able to make use of it? Now, my question to Alora is, if we eventually adopt reusable pads, my fear is infection. How do we prevent infection? Because we'll be talking about menstruation and menstrual hygiene. So then my second question is, questions have been coming. Some people, they want to delay their menstruation from coming. Probably they have a function or they just don't want it to come for a particular month. So this is to Dr. Ishak. Does it have any negative effects to say you want to use medications to push the flow of menstruation for that particular month forward? Thank you so much, and over.
So before Dr. Ishak takes that, Sarah unfortunately had to drop off the call for another conflicting activity, but she did mention that one of their initiatives at community level teaches the young girls to make their own reusable pads, and it's also, I think it has a training of trainers component whereby the girls teach other young girls to also make their own sanitary pads. Aisha also mentioned that through the KFW project at MSI Nigeria, reusable sanitary pads are being distributed for sustainability. And both Dr. Hamid and Charles have also mentioned the importance of sustainability when it comes to sanitary pads. We really don't have much time, but Dr. Ishak, are you able to take her question real quick?
Yes, the simple answer to that is that there is no health effect of not seeing your menses. But now when you put the angle of a drug, the challenge will be the drug use. There are various drugs that can be used to stop menses. Some of those drugs, when they use for too long, can cause permanent loss of menses, early menopause, premature menopause. So it's about the drug, not about not seeing the menses itself. Thank you.
Thank you so much, Dr. Charles. Aisha, one last contribution and then we're closing.
Okay, thank you so much, Okoyemi, for that, your wonderful question. I just wanted to address the part about where you asked if the sanitary pad, the usage, the reusable sanitary pad can cause infection. So most of them are lined with antimicrobial properties that prevents infection. And we should also know that they have a lifespan. So you're not using it forever. Most of them, I think you can use it for just 1 year. After 1 year, you have to discard and get a new one. So it's not something that is used for life.
Yes, but it does reduce the cost effect.
Yes, it does reduce the cost effect because you can use it for up to a year. But after a year, you have to discard and get a new one. But the more you have, I think the longer it can last. But most importantly, they are lined with antimicrobial properties. So that prevents infection. Even with washing and drying, those properties still are maintained till after the lifespan. Yeah.
Thank you, Aisha, for giving us that clarity. What a rich and enlightening conversation it has been today. We started off by grounding ourselves in the basics of menstrual health, what it is and why it matters, and how it connects to the health of women and girls, and how men and boys can also be involved in it. But we also explored the real life challenges that women and girls face, the impact of harmful social norms. We talked about the inadequate access to water, the limited meal support, and we also looked at the unique difficulties that women and girls with disabilities face while they're menstruating. Our speakers have offered practical and forward-looking strategies in relation to governance and to policy at community level, working with religious leaders, and even using reusable sanitary pads to end period poverty. But all of this is to make sure that we're supporting the woman and the girl at every level. At the heart of this discussion, it was one powerful question: what do women and girls want from men and boys to maintain their menstrual health? And the answer is very clear. We want support, we want understanding, and we want partnership, and we want the decisions to be made nationally. So as we mark International Menstrual Health Hygiene Day, let's commit to building a period-friendly society where menstruation is not a barrier, but a normal part of life, where no girl or woman is left behind because of her poverty. So on behalf of MSI Reproductive Choices, thank you to all our experts, our audience members who have been actively participating, to all our social media participants, and to anyone and everyone that joined us today. Let's please keep this conversation going in our homes, in our schools, in our communities, and in our policy making.